Well, joining me via Skype to discuss how Nigeria can increase its capacity to develop vaccines is the second Vice Chairman, Association of Public Health Physicians, Lagos Chapter, Dr. Alero Roberts. Dr. Roberts, good morning. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
Now, there have been concerns with regards to vaccines in terms of vaccine nationalism, and some persons would say that vaccine geopolitics, especially looking at the fact that it is taking a longer time for vaccines to get to this end of the world in terms of Africa and other countries, developing countries. And so a lot of persons have called for the need to look inward, not just as Africa, but perhaps Nigeria, beginning to look inwards for solutions to addressing the pandemic. And a lot of persons are saying that we have human resources, we have institutions of learning, but what is the challenge? Why is it taking us so long to develop a vaccine as a nation?
To be honest with you, this discussion did not start today. It did not start with COVID. We've been agitating for this for decades, ever since I was in medical school over 30 years ago. Coincidentally, the chairman of the Lagos State Traditional Medical Board is a renowned ophthalmologist, Professor Adefule Oshitelu. She was my teacher. This is something we have agitated for decades. So the truth of the matter is that it boils down to political commitment and the government willing to put its money behind its mouth. We can't continue to, just pay lip service to what is essentially a very deep-seated need. We're over 200 million Nigerians. We cannot say we lack the capacity to develop our own medicines and vaccines. We have so many MBBS graduates who are very, very interested, and not only MBBS, pharmacists, pharmacognosy, so many scientists. I can't even begin to name the cadres of scientists that are available to do this work. It's just the ability to be able to attract the funding and have that funding directed solely to the purpose of developing our own drugs and vaccines. COVID vaccine is just yet another call for the thing we have been agitating for decades.
Now, you talked about the government's commitment. The federal government recently said it is giving out 10 billion naira, perhaps, to support local production of COVID-19 vaccines. Isn't that commitment?
That is commitment. Where is the power? Where is the safety? Where is the security? I mean, electrical power. This thing requires, you heard that some of the vaccines require to be stored at minus 70 degrees centigrade. That requires a whole chain of engineering systems that are beyond just the science and the medicine and the pharmacy of producing the drugs and the vaccines. So, it's an all-round political commitment to this that we need to have in place. Admittedly, this is the best, we are in the best of times to actually achieve this. And I'm actually certain that this time around, we've got young scientists who have been mentored by greats such as Professor Adefule Oshitelu and others. Dr. Moshe Indemi is there. He was my classmate in medical school, who have actually done a lot of groundwork to getting this started. And what we now need is that we have seen how easily global supply for us to do it, and I know this time we are going to succeed.
When you talk about a facility, the government talked about its cold chain facilities, some of which it acquired to add to what it already has on the ground in waiting for the vaccines that would be receiving perhaps later next month. And so a lot of persons will say that these efforts being put in place by government is already showing some level of commitment. What more should the government be doing? Because there are others who are calling that perhaps government should sit with research institutions and some other persons that you have mentioned to ensure that moving forward we should have something.
Well, the thing is that we cannot deny the importance of public-private partnerships on this. There are a lot of private organizations who are willing to assist, to put hands, to put funds, but it has to be done with their terms and conditions as well involved. So once NAFDAC has approved and accredited the vaccines that are coming in, and the quality and whatnot, we set up supply chains and allow private sector participation to assist in making, because the issues aren't with the vaccines in and of themselves. Now there are more vaccines that can be stored at 2 to 8 degrees centigrade. There's even one of the vaccines that is what we call the one dose and done, it's just one dose, so the issues are going to be the logistics of distribution and the logistics of community engagement to reduce vaccine hesitancy. For this, you need the assistance of private sector, you need the assistance of community-based organizations, civil societies. It has to be an all-hands-on-deck affair, not one where 1 or 2 people can form a cabal and insist on holding, the whole entry of vaccines. And then people start to think, is it for their personal benefit? So these are things that we have to now open the platform and allow all players, all legitimate players, just put in place some of the terms and conditions that they need to be, they need to abide with, and allow other private players to get on board with vaccine rollout. This is the opportunity. The government cannot do this alone. We even lack the human resources for help to do this in the government sector. But by the time you co-opt the private sector into it, and through established networks, we will have a much easier time of this.
But it's the National Primary Healthcare Agency just trained about 12,000 health workers, I think, yesterday. And the government had said that it is only that agency that will be in charge of ensuring vaccine distribution across the country. You think that is not an ideal situation or an ideal decision to take?
It is an ideal decision to take. There's one agency in charge, the National Primary Healthcare Development Agency. They are entitled or empowered to bring in whomsoever they know to be credible players on the field. When you say 12,000 vaccinators, I just told you, even if we're only 120 million Nigerians, is one vaccinator going to do 120,000 people? How is that going? When will we finish? So 12,000 vaccinators for a population the size that we have is insufficient. Who else can you bring on board? Government cannot remunerate everybody that they bring on board. So you will have to bring on board other vaccinators in other organizations that will be remunerated by the private sector, by civil society, by community-based organizations. And they exist. These are existing networks. We're not saying set up something new. These are existing networks. You can't, the government, the NPHCDA can and will, I'm sure, because they are part of us, they will partner with professional bodies, the NAM, the National Association of Nursing and Midwives, Association of Public Health Practitioners, Physicians, us, SOPON, SOGON, PAN. There are so many professional bodies, PSN, so many professional bodies that we can, the NPHCDA can and should partner with to make sure that we can get the rollout fast, easily done, equitably done, and get everybody vaccinated as fast as possible with an effective vaccine.
Now, there are experts that are calling that perhaps African countries should come together and look at coming up with a vaccine for themselves, because it would require about 60% of its population to be vaccinated before we can say that we have herd immunity, that's as a continent. Now, do you see that as perhaps the way to go if Nigeria is seemingly not having the capacity to develop this on its own?
Look, there's no need to reinvent the wheel. I think the African Union has already developed such a committee, a conglomerate of African countries who are coming together. We can actually have what we call technology shifting, where countries that are actually producing the vaccine can then come and produce vaccines on the African continent. I believe some are being done in Kenya, South Africa has started, Nigeria can start, where we literally plug and play a vaccine production company into Nigeria, give them everything they need, and start the rollout from here. It can be done. I believe it's already being done, but I don't have the details, I must confess.
All right. Now, what Nigeria has up and running, as reports are saying, is an animal vaccine production laboratory. That's the National Veterinary Research Institute in Plateau State. And a lot of Nigerians are saying that what is being done differently that we can't adopt to perhaps develop human vaccines. From what it is being said, I wonder what perhaps we can learn to perhaps begin to look at building up whichever dimension we want to go, what we can learn from these animal vaccines being developed that we can use to address the gaps that we might have in the future.
In fact, thank you for reminding me. It's so easy. It's a very credible question, and one that is really so easy for us to be able to expand the operations of the animal vaccine production center to produce. I mean, a vaccine is a vaccine. The vaccine actually doesn't really care whether it's going into an animal forelock or a human arm. The point is that once you've got a vaccine production center up and running, to extend the production lines to produce more vaccines is a far easier reach than people think. And it's something that we can and should do. I'm sure we are even doing it as we speak. And certainly if we are not doing it yet, we certainly should do it very, very quickly.
All right. So with the variants now, because we have been seeing variants over the weeks and since last year, there are concerns that perhaps the efficacy, a lot of persons are beginning to question the efficacy of the vaccines to deal with it, which is another concern that is being generated. I wonder what you see with regards to this.
You are right. It is a concern because the more the virus is allowed to spread within the human population, the more likely we're going to see mutations that lead to variants, and some of these variants can eventually be, can overcome, may overcome the vaccine. So the point is that as fast as we can, we need to reduce transmission in the human population so that the vaccines we have are effective against whatever mutations or variants can arise. So that is this is just the science of it. If you allow the vaccine, the virus to be transmitted throughout the human population, we will see mutations. These mutations will lead to variants, and then we'll have vaccines but it's still easier to tweak an existing vaccine to become effective against a variant if we have knowledge of the variants that are coming in. So this requires the science of genomic sequencing as fast as we can so that we can identify the variants, identify what needs to be changed in the vaccine to make sure it's effective against the variant. How many variants are we getting? All this requires laboratory backup. We just need to be tracing and testing and sequencing all the infections that we can find so that we can be ahead of the mutations and be ahead of the variants that are likely to be developing.
All right. A second Vice Chairman, Association of Public Health Physicians, Lagos Chapter, Dr. Alero Roberts. Thank you for your time on the program.
Thank you very much for having me.